Thanks for joining us today. Welcome to the Center for State's video series on the essential functions for intervention testing, piloting, and staging. This series is produced by the Capacity Building Center for States and funded by the Children's Bureau. The Intervention Testing, Piloting, and Staging Brief is intended to help child welfare agency leaders, managers, and stakeholders take a structured approach to plan for and execute the rollout of a new program or intervention. It does this by providing step-by-step guidance to conduct usability testing where needed, determine the need for piloting a new program or intervention, and guidance to complete it, and finally, guidance on planning for staging and scaling up implementation of the new program or intervention. Intervention testing, piloting, and staging is broken down into 3 parts and 10 essential functions or tasks. And it's important to remember that not all agencies will complete all of the tasks in the brief, depending on their circumstances. And while the steps are presented in a linear way, often in practice these steps will overlap and be revisited as teams test, pilot, and stage. Part 1 is usability testing and includes creating a usability testing plan, and then conducting usability testing, analyzing results, and making adjustments, which are covered in modules 2 and 3 in this series. In this module, we will begin part 2 on piloting, and our first essential function is determining the approach and developing a plan. Then we move on to identifying and recruiting sites, conducting the pilot, and assessing results, reviewing progress, and making adjustments. And part 3 is staging and scaling up, including developing and refining plans for staging the intervention and scaling up, identifying sites and sequencing, building capacity and scaling up, and then reviewing progress and benchmarks. In this module, we will begin our conversation about pilot testing. Piloting helps agencies try out a program or practice with a small subgroup to inform decisions about expanding, adjusting, or discontinuing its implementation. The lessons learned from this testing can help teams make improvements to the intervention or the implementation approach and improve their chances for sustainable success. Let's get started. Why do teams need to determine an approach to pilot testing? As with many steps in the change and implementation process, it is foundational to think through the approach and the plan as a team. Thinking through the approach to piloting and developing a plan helps teams consider whether or not they can actually commit to a pilot test. Is there a need for it? Not all teams will go through with a pilot test for a variety of factors. And to identify the parameters during testing that will give them enough information from the pilot to decide next steps. For example, how long the test will last or how many sites there will be. How do teams determine the approach to pilot testing? Teams need to first decide whether they can commit to conducting a pilot. Not all interventions will undergo a pilot test. When working with an evidence-supported intervention with a strong research base, a limited implementation scope, and/or tight timeframes, teams may choose to move more directly into staging and scaling up. More details about these steps are available in modules 8 through 11 of this series. Piloting is particularly important when one or several of the following questions can be answered with a yes. Is the intervention new? Does it lack a strong evidence base? Has the intervention been adapted for a new population or setting? Are there any concerns about the fit with the system and current culture? Is the agency unsure about readiness for the intervention? Is the scope of implementation large and resource heavy? Could the impact of the intervention be far-reaching? Or is the price of failure high for the agency? If teams choose to not complete an official pilot, either due to timeframes or mandates, they should consider how they can use early implementation sites to test the intervention and make adjustments. Teams should consider the following questions when determining an approach to pilot testing. How does the scope, purpose, and complexity of the selected intervention impact the need for pilot testing? Is there a strong evidence base for the selected intervention? Will it be heavily adapted, or is it a new design? What priorities, as well as internal and external factors, affect the implementation approach and timing? For example, has there been high turnover or a leadership change? Is pilot testing preferable to moving directly to implementation? What are the potential risks of not testing? Why do teams need to develop a plan to pilot test? As with many steps in the change and implementation process, it's foundational to think through the plan as a team. Developing a plan helps teams to identify opportunities to test out implementation on a small scale and work out any issues before launching on a larger scale. It helps teams keep the pilot test doable and manageable within the agency context, to identify sites that have the capacity to carry out the pilot, or what resources may be needed, what potential roadblocks they might encounter, and to consider how and when they will engage site staff and key stakeholders, for example, court systems and community provider partners. Teams should develop a clear plan for pilot testing that reflects and builds on the intervention's existing research base and implementation history, the agency's experiences with implementation of other interventions. For example, if an agency has had trouble with a certain aspect of implementation, such as engaging community partner support, then the pilot plan should address ways to test new engagement approaches during the pilot. It should be flexible to accommodate learning over time. For example, the pilot test should allow for quick adjustments in implementation as appropriate. And the plan should inform decisions about scaling up and spreading the intervention. As noted earlier, the piloted intervention should be doable and manageable, and selected pilot sites should have sufficient capacity to implement the intervention, or capacity should be developed as part of the pilot process. And plans should reflect engagement of the site staff and key stakeholders, and anticipation of potential roadblocks. In the pilot plan, teams should answer the questions: what is being tested, why, where, how, and when. It should include the following elements: the purpose and goals of the pilot test, the scope of the intervention to be tested, information regarding the pilot sites, including selection criteria and the selection process, key activities during the pilot testing period, the data that will be collected, and the evaluation of the measures and processes, as well as costs where appropriate, available and needed resources and capacity building supports. Plans should address available resources, including technical assistance and capacity building for participating sites, but resources should be sustainable and realistic for what wide-scale implementation might look like. Supports may include funding, as well as training, materials, tools, access to coaches or experts, and communities of practice among pilot sites. The supports and resources offered may even act as an incentive to sites to participate. An outline of how the team will communicate the pilot plan, progress, results, next steps, and lessons learned. Expected challenges and strategies to address them. The testing timeframes, including a clear start and end date for the pilot period, and it should define the roles and responsibilities for the testing. And then before finalizing the pilot plan, teams should discuss the plan with leadership and other stakeholders to increase engagement and buy-in in the pilot testing process and the overall intervention implementation effort. Teams should consider the following questions together when developing plans for pilot testing. What will be piloted, and what's the purpose of the pilot? How might the purpose shape the scope, timeframe, and data collection needed? How will the team select sites? Are potential sites already engaged in the change and implementation process? What structures will be put in place to support staff during the pilot period? Have potential barriers been identified and removed? What is the anticipated time frame for testing? Is it realistic to gather all of the information the team might need to make decisions with? What are appropriate methods and measures to assess implementation processes during the pilot? What measures can explore short-term outcomes? And how can lessons learned be shared with other sites in the pilot or key decision makers and stakeholder groups? Thinking through these questions as a team will help develop a testing plan that is doable and manageable and results in the kind of information that will help the team make decisions on next steps for the intervention. Let's take a moment to check in on what you've learned about determining a pilot approach and developing a plan. Why do teams determine an approach and develop a plan? To determine the need for a pilot test and to keep the test doable and manageable within the agency context, and consider how and when they will engage site staff and key stakeholders. How do teams determine an approach and develop a plan? They consider whether to do a pilot test and then develop a plan that includes key elements, accounts for intervention and agency context, is flexible, and informs decisions about scaling up the intervention. What can help teams determine an approach and develop a plan? Considering as a team the factors that might lead to choosing to pilot test, and then developing a plan that includes the key elements and describes what is being tested, why, where, how, and when. Now take this a step further by reviewing the reflection questions for determine an approach and develop a plan in your intervention testing, piloting, and staging workbook to connect what you've learned to your own experience. Up next is identify and recruit sites, the fifth module in this series and the second essential function of pilot testing.
This video was created by the Capacity Building Center for States, funded by the U.S. Department of Health and Human Services, Administration for Children and Families, Children's Bureau, under contract HHS P2332014000033C. The content of this video does not necessarily reflect the official views of the Children's Bureau.